Hi, everyone. Thank you for joining us this evening. I would like to introduce our speaker, Dr. Ahmad, who is a board certified fellowship trained ophthalmologist specializing in LASIK, PRK, EVO ICL, and cataract surgery. In this session, Dr. Ahmad will walk you through three of today's most effective vision corrective procedures: LASIK, PRK, and EVO ICL. If you have any questions, please write them in the chat and Dr. Ahmad will answer it at the end. Welcome, Dr. Ahmad.
Thank you so much, Nicole, for that introduction. So today's outline, we're going to be sort of going through and diving deep into our three main refractive procedures, which are LASIK, PRK, and ICL. Most of you, I'm sure, are familiar with LASIK, but I'll give you a little bit more details about what that would entail, and then we'll kind of dive into some of the other options that are also available. So real quick here, agenda for today's discussion, we'll talk about specifically laser vision correction. So I want to take a step back first and sort of delineate when we think about refractive surgery, which is basically correcting surgery, correcting your refractive error, getting rid of your glasses. There's two different buckets. There's going to be the laser vision correction or cornea-based procedures, and then there's going to be the lens-based procedure, which is the EVO ICL. And we're going to talk about each extensively here shortly. Then we're going to talk about what can be corrected with each, with both laser vision correction as well as EVO. We'll talk about who is a candidate for each and who may not be a candidate, because not everybody is a candidate, what to expect, and then we'll take any questions that come along the way, as well as some that we have already prepared. So, what is laser vision correction? So this falls under the category of refractive surgery where we use lasers to dial in your prescription and change the shape of your cornea to basically minimize or eliminate your need for glasses or contact lens. In doing so, what we're effectively doing is creating a more optically neutral, optically correct cornea that allows the image to be focused directly on the retina, putting it in focus, right? So if you have residual refractive error, your image is either being focused in front of the retina or behind the retina. And when we use the laser to dial in your prescription, that image is finally focused directly on the retina itself, and that's what puts it in focus. The commonly known procedures are going to be LASIK and PRK under this category, and the goal is again to eliminate or minimize your need for glasses. So what can be corrected by laser vision correction is going to be these three categories. Nearsightedness or myopia, that's when people are able to see better up close than they are at distance. If you look at your prescription, it's going to have a minus in front of it. Farsightedness is or hyperopia, that's when distance is a little bit clearer than near, but may still be blurred. And that's going to have a plus sign on the front. And then distortion or astigmatism, where you have multiple images that are focused on the retina. And we'll talk a little bit about exactly what that would look like here in a moment. So specifically with myopia or nearsightedness, the image that's being focused inside of your eye is focused in front of the retina. So it's not directly being focused on the retina, and that causes the image to be blurred at distance. With hyperopia, it's the opposite. The image is actually focused behind the retina, and that causes both distance and near to be blurred, but distance may be a little bit more clear than near. And this typically does worsen with age. Astigmatism is when your cornea is shaped more like a football than a basketball, and it causes blurred vision, right? And so when we correct for astigmatism, we take these multiple focal points that are currently being refracted and we focus them into one single point that allows the image to be crisped. Now, vision correction options at Harvard Eye, we have the ability to do LASIK, which is the most common one that people are most familiar with. We have the ability to do PRK. Now, those are, again, are going to be your cornea-based procedures. And then we also have EVO ICL, which is going to be your lens-based option, where we implant a lens inside the eye. And we'll get into those details here shortly. Our mutual goal of refractive surgery is to be able to get you to be functional without need for glasses throughout your day. So after refractive surgery, most patients can drive a car, can shop, can work out, can go to work without glasses. In some cases, you may need an enhancement procedure either shortly after just to minimize any remaining refractive error, or in the future, if your prescription does change, you may be in need of an enhancement to further correct the vision. But again, the goal is to minimize or eliminate any need for glasses for your daily function. Now, LASIK specifically at Harvard Eye, the device that we use is called an iDesign. That's what takes all of the measurements, and it actually takes 1,200 personalized measurements of your cornea and creates a custom pattern that we then use a laser to dial into your cornea, right? And we use two lasers with LASIK. The first laser is used to create a flap, almost like a book cover. And then the second laser is what actually dials in your prescription. The laser that we use to create the flap is actually based here in Irvine, which is really nice to be able to have access to them. And it's a really, really accurate and precise laser that's been around for quite a few years now. And then the excimer laser is what actually changes the shape of your cornea. What range of vision can be corrected with these lasers? So if you have myopia, you have that minus number in front of the your prescription, we can go up to 12 diopters of myopia. For hyperopia, it's a little bit less. We can go to +6. And astigmatism, that's going to be, if you have astigmatism, it will be a number that follows the first number on your glasses or contact lens prescription, and that can go up to 6 diopters. So let's dive into a little bit about the first laser that we use for LASIK. So that's going to be called the femtosecond laser, and this is the laser that actually creates a flap. Before we had access to lasers, this used to be done with a keratome or a blade, so it was not as precise, not as repeatable. There was many more complications. Now everything is done by laser, so there's no blades involved at all. And the femtosecond laser minimizes complications for this step. It's very, very repeatable, very, very precise, and we're essentially creating this flap microns down in your cornea. So it has to be precise to be able to achieve those results. Now, with femtosecond laser, we are able to reduce thermal damage and distortion to any tissue. Again, it's very, very precise, highly repeatable, and it's a lot more comfortable for patients than the previous generation, which was the microkeratome or the blade. When we actually dial in your prescription, we use an excimer laser, and the amount of tissue that's reduced or that's being removed from your cornea is actually finer than your own human hair. So these are very, very, very precise lasers that are removing very minimal amount of tissue that cause a profound impact in your vision. So in order for these lasers to be able to achieve these results, it just speaks to the level of precision required to be able to do so. And so with LASIK specifically, again, we have two lasers. This is a good depiction of what actually goes on during the procedure. And the first laser, again, is going to create that book cover, that flap that we're seeing in the image here label 2. Once that flap is lifted up, the second laser then goes in and dials your prescription. So that's the excimer laser. It changes the shape of the cornea. And this part takes seconds, right? So it's about 20, 30 seconds. In some cases, even less than that, less than 10 seconds. Depends on the amount of your prescription. And then finally, after the second laser has completed its treatment, then we actually go ahead and lay the flap back down, and the procedure is complete. And we proceed with your second eye at that point. LASIK takes about 10 minutes or so per eye. And so in total, you're looking at a 20-minute procedure here. PRK is going to be very, very similar to LASIK, except rather than using the first laser to create a flap, we actually remove the surface layer of cells manually. And then we use the same laser, the excimer laser, to dial in your prescription into your cornea. And we'll talk about why somebody's a candidate for PRK over LASIK and some of the differences here in a moment. But what's nice about PRK is there's no flap involved, and which for some patients who are involved in a lot of high contact sports like boxing and things of that sort, or if you have a history of dry eye and you're looking to minimize the risk of dry eye after a procedure like this, then PRK is typically the preferred option. And so some facts here about PRK. It's the same laser and exposure pattern as in LASIK, so it's still a custom pattern. It's applied to the surface rather than under a flap. And we use this when patients have thinner corneas, or again, some of the other things that I'd mentioned about high contact sports, and reducing the risk of dry eye. So this is a good summary here of the pros and cons of each procedure. So pros for LASIK, it's going to be very rapid healing. Most patients can go back to work usually the following day. There's less post-operative discomfort. You get to your best corrected vision very, very quickly, usually within a day or two. Some cons that patients should be aware of is down the line, if you have significant trauma, like let's say you're playing a sport and you get like a finger to the eye, or you have some kind of trauma to the eye, that can cause the flap to dehisce or dislocate. And so that's something important to keep in mind. So if you are involved in a lot of high contact sports or high physical activities, you may want to consider doing PRK or EVO ICL, for example. And then dry eye, I always mention this in every single one of my consultations because it is a known risk of LASIK. And typically we see it peak at like 1 to 2 months after the procedure. And in most cases, it resolves, but it can be permanent in some cases. And so that's really important to keep in mind. If you have existing dry eye before you do any procedure, then typically we obviously want to treat it first to try to get you to a point where you're a lot more comfortable. And then secondly, we either consider moving to PRK, or if you had considerable enough improvement, then you can move forward with LASIK. Now, PRK, the pros or the benefits are going to be there's no flap, so there's no risk of having a flap complication in the future. And for patients who have thinner corneas where it's unsafe to take too much corneal tissue with the laser, then we prefer to do PRK in these cases. The cons, it is going to be a little bit slower healing. So for most patients, I say it's going to take about 4 to 6 weeks to get to your best vision. And during that period, you're going to wax and wane. So there's going to be some fluctuation in your vision, but ultimately around that 4 to 6 week mark is when we expect things to be stabilized. So that also speaks to the best vision obtained slower, and the incidence of dry eye is a lot lower in comparison to LASIK. And the reason why that is when we do the first laser for LASIK, when we create that flap is effectively creating severing some of the corneal nerves, and it takes time for those corneal nerves to regenerate, and that's why dry eye develops. With PRK, there's no insult to any of the nerves, so it doesn't take as long to recover those nerves, and there's less risk of dry eye as a result. Now, what if you are a candidate? What technology can we offer you here at Harvard Eye? Well, the technology that we have is wavefront guided. So this is custom LASIK or PRK. It measures how light travels through your optical system, and it creates a custom pattern based off of the 1200 measurements that we talked about. And it can treat a range of complex refractive errors that are typically not correctable with glasses. And it can treat, again, nearsightedness, farsightedness, and astigmatism. I think the key takeaway from this slide is that the treatment is completely personalized, it's completely custom to your eye and to your anatomy. As far as patient satisfaction goes, 95.4% of patients who've had LASIK or PRK report being very satisfied with the procedure, report that they would have it again in the future if they were to have it all over again. The dissatisfaction comes from several sources. One is residual refractive error. So let's say you do a treatment, you had LASIK or you had PRK, but you end up with still a little bit of refractive error. So you still have a small amount of prescription. Well, you can either, in that case, wear prescription for certain activities, like in some cases, patients may require glasses for driving, or you can have an enhancement done to correct the remaining error and basically be independent of glasses again. The second source is going to be dry eyes. That's going to be, again, higher with LASIK than it is with PRK. It typically, again, will peak at 1 to 2 months and then improves with time, but in some cases, it can be permanent. And then night vision, halos, and glares. So this is much, much less of an issue, less common, especially with this new generation of lasers. It's almost a non-issue at this point. Now that leads us to our next category of lenses, which are our next category of refractive surgery, which is going to be the EVO ICL, or the lens-based procedure. With EVO ICL, what we're effectively doing is we're taking your contact lens or your lens from your glasses, and we're implanting it inside of your eye. This way, the lens is designed to work with your cornea and the natural lens that currently sits in your eye. It's nice because it's an additive procedure. So unlike laser vision correction or LASIK or PRK, where you're removing tissue from the cornea, EVO ICL is working as an additive treatment. So there's no tissue removal, which means it's actually reversible. In the event that for some reason you want it removed or replaced, you can have it removed. Where the opposite cannot be true in LASIK and PRK. You cannot go back once you've had a laser vision correction. With EVO ICL, the lens is placed behind the iris, the colored part of your eye, and it sits in that space between the iris and your natural lens. We inject it through a very small incision. It's a 3 millimeter incision, and it's a very quick procedure. It's about 20 minutes or so for both eyes. Very safe, very effective, and we'll get to some of the nuances here. But essentially, that lens is going to sit right behind the colored part of the eye. Nobody can really see it unless you're being examined in the office with an eye care provider who can use a microscope to really look for it. So EVO ICL, some quick facts here. It was FDA approved in the USA for the last 15 years. It's been around outside of the US for more than 20 years, so it's tried and true. It's been around. It's very effective. It was EVO specifically, EVO ICL, the brand, was approved by the FDA in 2022. and it's currently one of the fastest growing refractive treatments worldwide. And they just actually expanded the age range. So initially it was approved for 21 to 45. It has now been expanded or extended to 21 to 60, which is fantastic because we have a lot more patients that we can offer this treatment to. And then lastly, the range of treatment is really pronounced. So it can go from a -3 to a -20. So for somebody who's like -11, -12 or above, we typically definitely prefer to do EVO ICL, even lower than that, because you don't want to max out the treatment guidelines for the laser vision correction, which we talked about for myopia was about a -12, right? So in this case, it may be safer to do EVO ICL. So a closer look here, you can see that lens is sitting right behind the colored part of the eye, the iris, and in front of your natural lens. And it sits there until it's removed. And it's usually removed at the time of cataract surgery, which all of us will develop cataracts in the future, and that's typically in your late 60s, early 70s, where you'll have to have cataract surgery. Now, some advantages of the ICL over laser vision correction. One is the quality of vision may be a little bit sharper because that lens is sitting more posterior, more closer to the retina. You're going to have excellent night vision, virtually no dry eye. Some patients may experience a little bit of dry eye immediately after surgery, but it does resolve. It's an additive procedure, so no corneal tissue is impacted and it can be reversed. It does have UV protection built in, and that's very important for some patients who are looking for that. It's removable, and in the event that you have a refractive error that develops or your prescription changes, you can have it swapped out or upgraded over time. But typically, these are designed one and done to be implanted at the time of surgery, and you really should forget about it for whatever reason. If you end up needing to have it swapped out, it can be swapped out. Now, EVO and ICL indications. So again, it's 21 to 60. It treats myopia and astigmatism. So unlike laser vision correction, which also treats farsightedness, this is going to be limited to myopia and astigmatism, -3 to -20. We want patients who have a stable refraction, and that typically means that your prescription has not changed more than 1/2 diopter over the year. And that's true for laser vision correction as well. We want to make sure that your prescription is stable and hasn't changed. Otherwise, you're chasing a moving target and you'll end up needing an enhancement in that case. So stability is really, really important. And we also are looking for patients with healthy eyes. So when you're coming in for a LASIK or an EVO consult, what I'm looking for as a surgeon is I'm looking for reasons not to operate, right? Reasons that you're not a good candidate for. And so we have extensive screening that we go through to make sure that you are a good candidate. And we talk about all the options that are available to you. And we sort of guide you through that decision-making process. Now, some of the EVO benefits, it's going to provide crystal clear vision. It's permanent but removable. You're going to get excellent night vision, excellent contrast, very, very low risk of dry eye, close to zero. It has UV protection in there. It's additive and 99.4% of patient satisfaction. So that's incredibly high for any procedure. Most patients who have this procedure report that they would have it again if they had to go back in time. Now, you may have seen some advertisements from Star, who manufactures EVO ICL. They've partnered with some of these celebrities. So you have Joe Jonas and you have this NBA star here as well. And so you may have seen some advertisements on social media or television from patients who've had EVO ICL advocating for it. Now, when we look at all three procedures here in combination, you can see EVO ICL is going to be your lens-based procedure where we're implanting that lens behind the colored part of the eye. LASIK and PRK are your cornea-based procedures. LASIK involves a two-step laser. The first laser is going to create the flap. The second laser is going to dial in your prescription. PRK is going to be a one-step laser where we remove the surface layer of cells and we use the same laser, the excimer laser from LASIK, and we dial in your prescription. And let's talk about some of the nuances here between the three. So all three are able to correct nearsightedness. Farsightedness is going to be only correctable with LASIK or PRK. Astigmatism also correctable by all three. If you have thinner than average corneas, we typically prefer to do EVO ICL or PRK. LASIK is usually not a good option in most of those cases. And then when we talk about logistics, visual acuity, like recovery, surgical time, things of that sort. So all three are going to give you excellent vision. Surgery time is going to vary between 15 to 30 minutes for all three. Recovery is going to be very similar between EVO and LASIK. So pretty much day one, day two, you're back to baseline, you're seeing really well. PRK may lag a little bit. You're looking at 4 to 6 weeks for your best recovery. The only one that's going to be reversible or removable is EVO ICL, and the only one that's going to have UV protection is also EVO ICL. Now, I want to show you a video here. So, forewarning, so if anybody is a little queasy, maybe turn away for a few minutes here, but I want to show you a video of EVO ICL actually being done. So here we're making a small incision. This incision is going to be 1 millimeter. And then we make a second incision here as well. That's also 1 millimeter. So these are very, very tiny incisions. You're going to see a little numbing medication that's going in. So that's how we make sure that this procedure is completely pain-free. You also have anesthesia on board. And here we have some gel that's going into the eye. This helps to keep the eye formed and keep it stable. And then we're using a blade here to make the main incision. And this is going to be your 3 millimeter incision. So these are very, very small incisions. It looks big here on the microscope, but in reality, these are very, very small incisions. And then what we're seeing here is the lens that's already been folded is going to be implanted in the eye. You'll see it here. It's being injected. It's going to come out very slowly, almost like a taco, and then it's going to slowly unfold. And you'll see once it unfolds, it has four little foot plates on each end, each quadrant. And the goal of the surgeon is to basically position that foot plate behind the iris or the color part of the eye. And you'll see that here. So a little bit of more jelly just to help push it down further. And then you'll see using a manipulator here to maneuver each foot plate behind the color part of the eye. You'll see that here. So there's one. The second one is going in here as well. And then you'll see the other 3 and 4 are tucked here. And then once that last foot plate is in, the procedure is pretty much over. We're just going to rinse out the jelly that we used in the beginning, and then we're going to seal the incision. And the nice thing about this incision is it's sutureless. So there's no suture that needs to be removed later. It's all sutureless, very fine micro procedure, and requiring a lot of precision, actually. And this is sped up. This is a little bit sped up, about 1.5 times speed. So that's it. And then the same procedure is repeated on the second eye. Now, let's talk about what happens when you're around the age of 45 or 50 and you're coming in and you're starting to have some difficulty seeing up close. And this is something that all of us are going to go through. Around the age of 45, 50, the natural lens that we all have inside of our eye starts to harden, right? And that's a process that's called presbyopia. When that lens hardens, we start to lose the ability to see up close without glasses. So that's why you'll see a lot of people who carry around cheaters or over-the-counter reading glasses. It's because their lens is starting to harden. And so this presents a little bit of a dilemma if you're looking to have a procedure done to correct your vision. So what we typically do in these cases is if you decide to have laser vision correction or EVO ICL, we can put lenses in for distance. However, if we put a lens in for distance, then you'll still need to use reading glasses for up close work. So it doesn't eliminate glasses altogether, but it does make you more functional for distance. The other option around that is to do monovision, where you do one eye set for distance and the other eye set for near, and the eyes are designed to work together to give you full range of vision. And a lot of patients actually who are looking to get independence from glasses or contacts around this age will opt for monovision because it gives them the ability to be glasses independent. There are some compromises that you'll have to make with monovision. So one of them is depth perception. So the eyes are not going to be working at the same focal points. So you lose a little bit of depth perception and you lose a little bit of binocular visual acuity. But once your brain adapts or adjusts, and you'll know relatively quickly if your brain is going to adjust because we typically do a contact lens trial in the office before we do it surgically to make sure that you're going to tolerate it. But once your eyes do tolerate it or your brain adjusts, then the level of quality and the level of range is pretty much unmatched at that age. Now, what are some of the complications that you may have if you were to undergo LASIK, PRK, or EVO? So one of the most common is going to be under or over corrections. And these complications, quote unquote, are very rare. They are less than 1%, but we do encounter them because we do quite a bit and we do have ways of correcting it. So if you are under or over corrected, you may require an enhancement procedure to correct that remaining refractive error. If you have halos and glare, They typically do reduce over time. And as I mentioned earlier, our newest generation of laser has markedly reduced these phenomena from developing. So most patients really don't complain of these issues anymore. Dry eye, you can experience it with any eye surgery. I always say that. More common with LASIK, typically resolves after 1 to 2 months, but in some cases, it may be something that you have to deal with, especially with LASIK. But again, these complications are far, far less than 1% in most cases. Now, are you a candidate? So when you come in for a consult with me, essentially, like I mentioned, we're looking for reasons not to operate. We're looking for reasons that may make your eye unsuitable for having surgery. So you're going to go through a series of testing. We do a full eye exam. We do multiple images. We check your cornea, specifically looking at corneal thickness. We look at your maps to see if there's any areas of irregularity. We also look at the health of your retina. We do a retinal scan as well. We check your prescription, with both your glasses prescription that you came in with, as well as your contacts. We also check your current refraction in the office. We look again at your corneal thickness and we assess your pupils as well. So you're getting a very comprehensive exam when you're coming in for these consultations. Now, after we examine your eyes and we look at all the testing and we determine you're a candidate, you may be a candidate for more than one procedure, right? And that's where there's going to be a discussion that we have to sort of guide you on what your priorities are and which procedure may be more beneficial to you. And so that's really an extensive conversation that we usually have at that point if you are a candidate for more than one procedure. And again, the tests that we go through are very detailed. We're looking specifically at your corneal maps, and we're matching that with the exam, correlating that with the exam to make sure that everything is matching up correctly. Now, who may not be a candidate for these surgeries or these procedures? If if you've had herpes virus in the eyes, and this is very common, it's not necessarily an STI. Patients can have it if they had a history of chickenpox or anything like that. The virus is living in you, and it can choose to attack the eye. So there are a lot of patients who have herpes virus that attacks the eye, the cornea, or the inside of the eye. Those are going to be higher risk patients, and so we would want to know about that before we proceed with any surgery. If you've had previous radial keratotomy, so that's sort of an outdated or antiquated procedure that used to be done decades ago to basically change the shape of the cornea by making certain incisions. And so we typically don't like to reoperate on those patients. If your prescription has not been stable, and again, we define stability as no more than a half diopter of change in 1 year. If you've had a history of a lazy eye, laser vision correction or EVO ICL is not going to help fix that, right? That's something that is related to neurology at that point, and laser vision correction can only correct optical changes, cannot change what's been done over years. If you're a keloid former and you're prone to sort of forming scars or poor wound healing, we want to know about that because it can impact your outcomes and your healing if you were to have laser vision correction. If you're pregnant, you definitely want to wait until after you're done breastfeeding, not just after delivery, but after you're done breastfeeding as well, because your prescription can fluctuate, especially with hormonal changes as well. If you play martial arts or contact sports, boxing, things of that sort, we may steer you more towards PRK or EVO instead of LASIK. If you're taking medications like tretinoin or Accutane, so a lot of patients take these medications for acne, then we definitely want to discontinue them because they can impact your healing process. They can lead to dry eye, things of that sort. If you have any other medical condition, really, we want to know about it. If you have diabetes, lupus, autoimmune conditions, HIV, or you have a history of poor wound healing, those are all factors that can impact the outcome of these procedures that really need to be mentioned at the time of your consultation. If you're contact lens wearers, it definitely can impact your measurements that we take. So ideally, if you're in soft contact lenses, we want you out of the contacts 1 to 2 weeks before we do your final set of measurements, not necessarily before the consult, but before we do your actual pre-op appointment. If you're in hard contact lenses, those you need to be out of for at least 4 weeks, in some cases more, and we want to make sure that your measurements stabilize before we move forward with surgery. So it really depends. And then ultimately, what should you expect at your consultation? So, one, expect a very thorough, very comprehensive exam. We're going to check your refraction or your prescription. We're going to do corneal maps. We're going to have a very thorough discussion about all your options. And ultimately, that way you're the most informed that you can and you make the best decision for you at that point. Now, day of the procedure, what can you expect? So we verify all measurements, both of these options, so laser vision correction as well as lens-based procedures are painless experiences, so you really shouldn't have any pain. It is common to have some foreign body sensation, some irritation after the procedure is done temporarily in the healing phase, but long term, nothing like that should be ongoing. And then LASIK and PRK are done in the office, so you actually come to our clinic. EVO ICL is going to be done in the OR, so a little bit different setting there. Recovery wise, we touched on this already, but LASIK and EVO ICL are going to be very quick recovery. You can go back to work usually within days. You do have to come in 1 day after surgery, 1 week, and 1 month, and then usually just annual visits after that. PRK is going to be a little bit longer than LASIK or EVO ICL. So after the procedure is done, we put temporary contact lenses on the eyes for healing purposes. Those contact lenses are typically removed 1 week after the procedure, so those are not permanent. And then the post-operative visits are typically, again, 1 day, usually 5 to 6 days out. And then we see you again at the 4 to 6 week mark where your vision has stabilized at that point. Now, some questions that I often get during these consultations. So, what happens if you blink or move during the surgery? So, if we're talking about laser vision correction, the lasers are equipped with iris registration. So, they're looking at the iris. They're also equipped with their eye movement tracking. So, there's tracking devices that are going on at all times. And if there's significant movement, enough movement detected, the laser will stop and pause. So, that's something not to be too concerned about. During surgery, so if we go do EVO ICL, we use a little speculum that we put in the eye or an eyelid holder to keep the eyelids out of the way. And the anesthesia or the sedation that we provide helps to keep you calm and comfortable and keep you from moving. Do either of these procedures hurt? No, none of these procedures are painful. All of this should be painless, and you will be very, very comfortable throughout the whole procedure. How long does each procedure take? We talked about this 15 to 30 minutes, depending on which option you choose. And all of them are going to provide really quick results for you. How quickly can you go back to work? With LASIK and EVO ICL, generally it's within a couple days, day or two. With PRK, I'd say probably take a few days off, maybe a week before you can really go back to work. What happens if you're under or overcorrected? So in those instances, you may require an enhancement, but typically we give you a little bit of time to make sure that you heal and you stabilize. And in most cases, a lot of times things just kind of improve with time. In some cases, if there's still remaining refractive error, you may have to have an enhancement done. What happens if you develop dry eye? So this is a really good question, right? If you have pre-existing dry eye, we definitely want to treat it because it can correlate with developing worsening dry eye after surgery. At the same time, if you've never had dry eye, you can develop temporary dry eye for the first month or two after these procedures. And so we will treat them aggressively, typically with artificial tears that you can get over the counter, warm compresses. In some cases, we may recommend doing prescription drops like a topical steroid or a non-steroid just to help you get by. But in most cases, dry eye is transient and typically resolves with time. And then lastly here, is it worth the cost? And I think the best analogy that this comes down to is renting versus buying. So if you think about glasses or contact lenses, those are going to be forms of renting your vision. You're spending probably hundreds of dollars each year on the cost of contacts and glasses. Whereas if you were to have a procedure done like laser vision correction or EVO ICL, you're buying your vision. You're no longer renting. And the cost of the procedure ends up being significantly less than the cost of contacts or glasses over the years. So in the majority of cases, it definitely is worth the cost when you look at it from that lens. And so with that, thank you guys so much for joining us tonight. I'll go ahead and turn it back to Nicole, and we'll go through any questions that have come up.
Perfect. Does anybody have any questions? If you do, you can put it in the chat.
We also have a QR code here. If you're interested in coming in for a consult, this will take you to that link, and we'd be more than happy to see you. And so feel free to use your smartphones to scan the QR code there.
We'll just give it one more minute. Okay, so there is a question. What enhancement is done on EVO ICL patients who are over/undercorrected?
So that's actually a really good question. And it depends. It depends on your corneal scan. In some cases, if you have a healthy amount of tissue and your cornea looks healthy, then you can have LASIK. If your cornea is on the thinner side, then we'll typically do PRK.
Thank you. And there's another question. I am 51 and had LASIK at 40, undercorrected. Would EVO ICL or cataract lens be better option?
That's also a very good question. So it depends on the amount of prescription. So remember, EVO ICL, the lowest it can go to is a -3. So if the refractive error that's left over is not quite a -3, then EVO ICL would not be an option. If you're looking to get full range of vision in each eye, then having a refractive lens exchange would actually be probably the best way to go. But it depends on your measurements and your prescription and the health of the eye, because ultimately we want to make sure that you're a good candidate for some of those full range of vision lenses that we would implant at the time of surgery. So most likely you'd probably be a candidate for a refractive lens exchange, but we would have to assess and do a comprehensive exam before we can say that for sure.
Great. I believe those are all of our questions. Thank you, Dr. Ahmad, for presenting, and thank you, everyone, for attending. You should receive an email link of this webinar um, through the email you enrolled. Thank you.
Thank you guys so much. Have a good night.